So I am one of the founders of Claire's COVID-19 task force. And when the COVID-19 pandemic hit Italy, the first European country to really face the emergency, I felt the urgency to do something, to use AI technologies to support our governments, health institutions, and doctors to tackle the pandemic. So together with Claire, we set up a first group of AI experts who looked at what the countries in the Far East who were already in the middle of the pandemic, what they were already doing basically. And so what we did is that we launched a call to the networks of Claire's European AI scientists, and we quickly recruited around 150 researchers from all the different fields of AI. And we started organizing their effort to give a concrete support to European countries. I'm Emanuela Girardi. I'm the founder of POP AI, Popular Artificial Intelligence, and I'm part of the group of experts selected by the Italian Ministry of Economic Development to write the Italian National AI Strategy. I've been involved in developing Claire's network from the very beginning. I'm part of Claire's industry task force, and I'm a member of Claire's advisory group on industry. I do believe that Europe needs today more than ever a center for AI research and development for two reasons. The first is to become a leading player in the global AI landscape. And the second, which is even more important, is to give direct support to European governments in situations like the COVID-19 crisis. I do believe that Claire, whose vision is to develop a human-centric, trustworthy AI, can play this role and become the lighthouse of the global research in AI. About 150 researchers offered their time to work for Claire's task force. So according to the different expertise of the volunteers, we divided them in 7 groups, and we selected a topic coordinator for each group. So each group focused on a different area of AI, from bioinformatics to image analysis, from scheduling and resource management to epidemiological data analysis. So as coordinators, what we did is that we organized and coordinated the work of the 7 groups. We collected AI and COVID-19 initiatives from Europe and internationally. And we created a website to publish and share this database and all the accomplishments of our task force. I really felt like I was doing something concrete and useful to help fighting the pandemic. So together with all the members of the task force, we dedicated our time, our energy, and our enthusiasm to show how we could use AI technologies to help doctors and governments to tackle the pandemic. So basically, the 2 biggest challenges had been first, the lack of data, and second, the lack of AI skills and culture in decision makers and health sector. So European governments need to develop educational programs to promote the AI skills on one side and to invest in infrastructure to collect, analyze, and share data. I think that it took a pandemic to understand how it's important to invest in AI research and in AI development. And now AI research and development should really become one of the priorities of our government's agenda. We are thinking about the second phase of the task force, focusing on one side on how to use AI technologies to analyze and improve the vaccination plan, or the European vaccination plan, and on the other side, leveraging from what we learned from this experience, we really would like to develop a European initiative focused on AI in health.